Hello everyone, how are you? Welcome to another videos for MRCS exam, and this type of question is frequently repeat in the exam. So here is one of the question. So here see the question: a 18 years old lady with troublesome hyperhidrosis of the hand and arms is due to undergo a sympathetictomy to treat the condition. Which of the following should the surgeon divide to most effectively treat her condition? So here, after careful reading, first of all we have to find out the key point to answer the question, or the most important point in the question to answer the question. So here you can see a 18 years old lady with troublesome hyperhidrosis of his hand and of her hand and arm, and undergo sympathetictomy to this condition too. So this point is important. She undergone sympathetictomy. Which of the following should be surgeon divide to most effectively treat her? So we have to find out one of the five options which will be the answer of the question. So here the options. The options are sympathetic ganglia at thoracic 1, thoracic 2 and thoracic 3, sympathetic ganglia at thoracic 2, thoracic 3, sympathetic ganglia at thoracic 1 and thoracic 2, stellate ganglion, and superior cervical ganglion. So let's see here. We know that the whole body sympathetic supply is supplied by the thoracolumbar outflow. That means the sympathetic supply derived from the thoracic region and from the lumbar region. So the thoracic region, that means thoracic 1 to thoracic 12, and lumbar, that means lumbar 1 to lumbar 5. These vertebral segments are responsible for the sympathetic supply of the whole body. So here we can see this is the cervical enlargement, and from the cervical enlargement, that means from the cervical part of the spinal cord, there are different sympathetic nerve arise, and they supplies in the head neck region and the upper limb region and part of the thorax region. And on the other hand, there is another, this is the lumbar enlargement, and in the lumbar enlargement different type of sympathetic supply arises, and the supply below, that means the lower limbs in the perineal region, part of the abdomen, and sometimes part of the thoracic area. So we can see this is the whole of the spinal cord, but only the thoracic part and the lumbar part is responsible for the sympathetic outflow for whole body. So for sympathetictomy, we have to cut a thoracic region or lumbar region. So here this indication, this mark is quite incorrect here. The thoracic part and lumbar part. So whole of the cervical region and the coccygeal region, they are not play in role in the sympathetic supply, because the sympathetic nerve arises from the thoracic region and it goes upward and supplies the head neck region and the upper limb region. So in the another picture we can see here the vertebral column and the spinal cord here. This is the cervical vertebra, thoracic vertebra, and thoracic part of the spinal cord, and this is the lumbar vertebra and lumbar part of the spinal cord, and here the sacral and coccygeal area. So the thoracic part and the lumbar part of the spinal cord, they are responsible for the sympathetic supply. So in this picture here we can see this is the thoracic part, and in this thoracic part the sympathetic supply arises, and this sympathetic supply supplies, here we can see in the upper part, that is tarsal muscle, dilated pupilla in the eye, then head neck region, thorax, heart, bronchus, and other parts of the body. And from the lumbar region, they supplies the lower part of the body. And here we can see this is the lumbar region. So this thoracic and lumbar region, from the thoracic region upper part, that means head neck region and the upper limb region, they are supplied by this upper part of the thoracic sympathetic nerve. In this picture we can see this is the cut section, and this is the upper part of the sympathetic nerve, and here we can see the superior, middle, and inferior ganglion, and the sympathetic nerve, it goes from here to here and goes to the eye. So if the nerve is injured in this point here, there is a chance of development of the Horner syndrome. So to prevent the Horner syndrome, the first, that means thoracic spinal cord or thoracic spinal nerve is spared to prevent the development of the Horner syndrome. So here our answer is the sympathetic ganglia, that is thoracic 2 and thoracic 3, that supplies the upper limb, it is cut, and thoracic 1 is usually spared because to prevention of the development of the Horner syndrome. So for sympathetictomy of the upper limb or hand and the arm, there is the sympathetic ganglion that is arising from the thoracic 2 and 3, that is cut. Thank you all.